Our skin, the largest organ in our body, is our first line of defense against the outside world. But sometimes our skin cells can grow abnormally, leading to skin cancer. Non-melanoma skin cancer is a common type of cancer that affects millions of people worldwide. It develops in the skin's top layers, primarily from cells called basal cells and squamous cells. These cancers are usually less aggressive than melanoma, another type of skin cancer. Throughout this video, we'll delve into the specifics of non-melanoma skin cancer, equipping you with the knowledge to protect yourself and your loved ones. Early detection is key when it comes to successfully treating non-melanoma skin cancer. Because these cancers often grow slowly, they might not cause noticeable symptoms in their initial stages. It's essential to be aware of any unusual spots, sores, or growths on your skin. Pay attention to any changes in size, shape, color, or texture. If you notice anything unusual, don't hesitate to consult a healthcare professional. Early diagnosis significantly increases the chances of successful treatment and minimizes the risk of complications. Non-melanoma skin cancer often announces itself through subtle changes in your skin's appearance. Keep a watchful eye out for any new growths, spots, or sores that develop on your skin, especially in areas frequently exposed to the sun. One of the most common signs of non-melanoma skin cancer is a pearly or waxy bump, often with visible blood vessels. Another warning sign is a flat, scaly patch of skin that might be red, brown, or flesh-colored. Remember, not all skin changes are cancerous. If you notice any unusual growths, sores, or spots that don't heal within a few weeks, consult a dermatologist or healthcare professional for proper evaluation. Diagnosing non-melanoma skin cancer involves a multi-step process that typically begins with a physical examination by a dermatologist. The doctor will carefully examine your skin, paying close attention to any suspicious areas. If the dermatologist suspects skin cancer, they will likely recommend a biopsy. This procedure involves removing a small sample of the affected skin tissue and examining it under a microscope. The biopsy helps determine the type of skin cancer, its aggressiveness, and the best course of treatment. Depending on the type and location of the suspected skin cancer, the dermatologist might perform a punch biopsy, shave biopsy, or excisional biopsy. Navigating the world of skin cancer can feel overwhelming, but remember, you don't have to go through it alone. If you have any concerns about your skin health, don't hesitate to seek expert advice from a qualified dermatologist. These specialists are trained to diagnose and treat various skin conditions, including non-melanoma skin cancer. The dermatologist will examine your skin, answer your questions, and recommend the most appropriate course of action. By staying informed, being vigilant about your skin health, and seeking professional help when needed, you can take proactive steps towards protecting yourself from this common, yet treatable condition. Non-melanoma skin cancer is an umbrella term that encompasses several different types of skin cancer. The two most common types, basal cell carcinoma and squamous cell carcinoma, arise from different cells within the skin's layers. Basal cell carcinoma, the most prevalent type of skin cancer, originates in the basal cells, which are found in the deepest layer of the epidermis. Squamous cell carcinoma, the second most common type, arises from the squamous cells, which are located in the middle layer of the epidermis. While both types of non-melanoma skin cancer can develop anywhere on the body, they are most commonly found in areas frequently exposed to the sun. Sun exposure is a major risk factor for all types of skin cancer, including basal cell carcinoma and squamous cell carcinoma. Basal cell carcinoma is the most common type of skin cancer, accounting for the majority of non-melanoma skin cancer cases. While it is considered a slow-growing cancer that rarely spreads to other parts of the body, early detection and treatment are essential to prevent local tissue damage and potential complications. Basal cell carcinoma often presents as a pearly or waxy bump on the skin. It may also appear as a flat, flesh-colored or brown scar-like lesion. If you notice any persistent bumps, sores, or growths on your skin, especially in sun-exposed areas, it is important to consult a dermatologist promptly. Early diagnosis and treatment are crucial for achieving the best possible outcome. Squamous cell carcinoma, the second most common type of non-melanoma skin cancer, arises from the squamous cells in the epidermis. Squamous cell carcinoma often appears as a firm, red nodule or a flat lesion with a scaly and crusted surface. These growths can develop anywhere on the body, but are more common in areas exposed to the sun, such as the face, ears, neck, lips, and hands. Like basal cell carcinoma, early detection and treatment of squamous cell carcinoma are essential for successful management. If you notice any suspicious growths, sores, or lesions on your skin, especially in sun-exposed areas, it is crucial to consult a dermatologist for proper diagnosis and treatment. When doctors diagnose cancer, they use a process called staging to determine the extent of the disease. Staging helps doctors understand how large the tumor is, whether it has spread to nearby lymph nodes, and if it has reached distant organs. This information is crucial for developing an effective treatment plan and estimating the patient's prognosis. The staging system for non-melanoma skin cancer typically uses the TNM system, which stands for tumor node metastasis. The T category describes the size and extent of the primary tumor. The N category indicates whether cancer has spread to nearby lymph nodes. The M category signifies whether cancer has metastasized, meaning it has spread to distant organs. Non-melanoma skin cancers are typically staged using a simplified version of the TNM system, often focusing on the T category to describe the tumor's size and invasiveness. Stage 0, also known as carcinoma in situ, indicates that the cancerous cells are confined to the epidermis, the outermost layer of the skin. Stage 1 non-melanoma skin cancer is characterized by a small tumor, usually less than 2 centimeters in diameter, that has not spread beyond the epidermis or dermis. Stage 2 encompasses larger tumors, typically greater than 2 centimeters in diameter, that may have extended into the dermis but have not spread to nearby lymph nodes or distant sites. Stages 3 and 4 indicate more advanced disease. Stage 4 non-melanoma skin cancer is rare, but signifies that the cancer has metastasized to distant organs, such as the lungs, liver, or brain. Accurate staging is crucial for determining the most appropriate treatment approach for non-melanoma skin cancer. In the early stages, treatment typically involves surgical removal of the tumor, often with a wide margin of healthy tissue to minimize the risk of recurrence. Other treatment options include radiation therapy, topical chemotherapy, and photodynamic therapy. As the stage of non-melanoma skin cancer progresses, treatment becomes more complex and may involve a combination of therapies. Understanding the stage of non-melanoma skin cancer also helps doctors provide patients with a prognosis, which is an estimate of the likely course of the disease. Non-melanoma skin cancer, like many other cancers, arises from a complex interplay of factors, with some individuals being more susceptible than others. One of the most significant risk factors for non-melanoma skin cancer is exposure to ultraviolet, UV, radiation from the sun, or tanning beds. UV radiation damages the DNA in skin cells, increasing the likelihood of mutations that can lead to cancer. Other risk factors include fair skin, a history of sunburns, especially during childhood, and a weakened immune system. By understanding the risk factors associated with non-melanoma skin cancer, you can take proactive steps to protect yourself and your loved ones. Simple measures like wearing sunscreen, seeking shade during peak sun hours, and avoiding tanning beds can significantly reduce your risk of developing this preventable disease. The sun, while essential for life, emits ultraviolet UV radiation, which is a known carcinogen, meaning it can cause cancer. UV radiation damages the DNA in skin cells, increasing the likelihood of mutations that can lead to skin cancer, including both melanoma and non-melanoma skin cancers. There are two main types of UV radiation that reach the Earth's surface, UVA and UVB. UVA rays penetrate deep into the skin and contribute to premature aging, wrinkles, and age spots. UVB rays are primarily responsible for sunburns and play a significant role in the development of skin cancer. Protecting your skin from UV radiation is crucial for preventing skin cancer. While UV radiation exposure is a major risk factor for non-melanoma skin cancer, several other factors can increase your susceptibility to this disease. These factors include genetics, skin type, age, and certain medical conditions. People with fair skin, light hair, and blue or green eyes are more prone to developing skin cancer than those with darker skin tones. This is because melanin, the pigment that gives our skin its color, provides some natural protection against UV radiation. Age is another risk factor, as the risk of non-melanoma skin cancer increases as we get older. Certain medical conditions, such as a weakened immune system or a history of other skin cancers, can also increase your risk. The good news about non-melanoma skin cancer is that it's highly treatable, especially when detected early. The choice of treatment depends on several factors, including the type of skin cancer, its size and location, the patient's age and overall health, and their personal preferences. The goal of treatment is to remove the cancer completely while minimizing any potential side effects and preserving as much healthy skin as possible. Your healthcare team will work closely with you to develop an individualized treatment plan that addresses your specific needs and goals. Treatment options for non-melanoma skin cancer can be broadly categorized into surgical and non-surgical approaches, each with its advantages and considerations. Your doctor will discuss the most appropriate treatment options based on your specific situation, ensuring you understand the benefits and potential risks of each approach. Surgery is the most common treatment for non-melanoma skin cancer, offering high cure rates, especially for early-stage cancers. There are various surgical techniques available, each tailored to the specific characteristics of the tumor. One common surgical procedure is called excisional surgery, which involves removing the entire tumor along with a margin of surrounding healthy tissue. Another technique is Mohs surgery, a highly specialized procedure often used for cancers located in cosmetically sensitive areas or those that have a higher risk of recurrence. Mohs surgery involves removing the tumor layer by layer, examining each layer under a microscope until all cancerous cells are removed. Your surgeon will discuss the most appropriate surgical technique based on your individual case, considering factors such as the cancer's size, location, and your overall health. In addition to surgery, several non-surgical treatment options are available for non-melanoma skin cancer. These approaches are often used for cancers that are small, superficial, or located in areas where surgery might be challenging or undesirable. Non-surgical treatments aim to destroy cancer cells while minimizing damage to surrounding healthy tissue. One commonly used non-surgical treatment is radiation therapy, which uses high-energy rays to target and destroy cancer cells. Radiation therapy can be delivered externally using a machine that directs the radiation beams to the tumor site, or internally using radioactive implants placed near the cancer. Another option is topical chemotherapy, where anti-cancer medications are applied directly to the skin to kill cancer cells. Photodynamic therapy is another non-surgical treatment that uses a combination of light and a photosensitizing agent to target and destroy cancer cells. Cryotherapy, which involves freezing the tumor using liquid nitrogen, is another option that can be effective for small, superficial cancers. Your doctor will recommend the most appropriate non-surgical treatment based on your individual case, considering factors such as the cancer's size, location, and your overall health and preferences. Non-melanoma skin cancer is common but treatable, especially when detected early. Your skin tells a story etched with experiences and sun-kissed memories. Care for your skin with healthy habits and regular checkups. Understand risk factors, recognize warning signs, and seek prompt medical attention. Make sun protection a daily routine. Use broad-spectrum sunscreen with SPF 30 or higher. Regular self-exams are crucial. Knowledge is power. Protect your health. Consult a dermatologist for any unusual changes. Early detection ensures a healthier future.